Okay, so I have here now a femur bone. So this, of course, then would be the medial side, going all the way down, the medial side of the femur. It's got a head region, followed by a, can't really see that, sorry. It's got a head region, followed by the neck. Now looking at the head, you have this little indentation almost right in the center. We call this the fovea capitis femoris. So this is going to serve as an attachment point for the ligamentum teres. If we continue along distally, we have, as I mentioned, the femoral neck here, which you can get fractures to that area. This large projection on this lateral aspect is called the greater trochanter. And the greater trochanter really serves as a key point of muscle attachment for many different muscles. So just to orient yourself again, you are looking at an anterior view of the femur here. And again, we're looking at the most superior aspect. I'm going to zoom in a little bit closer so you can see some of these specific areas. So we have our greater trochanter, which is here, and then if I follow this line down, I get to another bump, not as large as the greater trochanter, so we call this the lesser trochanter. And in between here, this ridge, we call the intertrochanteric line. So this is going to be a key area where we're going to see our ligaments. Here you can see it better there. You're going to see this as an attachment point for ligaments of the hip joint. Now if I turn this direction, let me see if I can get you oriented here. So this is the head, followed by the neck, and then they're right in between the neck and the greater trochanter. There's this shallow groove, if you will, and this is called the trochanteric fossa. Now on the back side, the posterior side, we also have what looks to be like a connection between the greater trochanter here and our lesser trochanter, and we call this the intertrochanteric crest. Okay, it's a little bit more pronounced on this side, on the posterior side. So just to review, we have a line that is anterior, intertrochanteric line that is anterior, and an intertrochanteric crest, which is posterior. On the posterior aspect of the greater trochanter, and just coming down distally here, there's this little bump, and we call that the quadrate tubercle. And this is where the quadratus femoris muscle is actually going to insert in that particular area. Now we're going to continue looking at the posterior aspect here. This is difficult to zoom in enough to see, but you can start to see some of these ridges and lines here. This large one here is for a very large muscle, our gluteus maximus. And if you look, it's just distal to the greater trochanter, and it's this roughened area on the lateral aspect. We have what's called the spiral line right in this direction, and those are feeding right into a ridge on the posterior aspect of the femur. So the femur, when you look at it, it's difficult to see, but it's almost triangular in shape. So this pointy part in the posterior aspect we call the linea aspera, and it has a medial lip and a lateral lip as well, and this becomes an important area of muscle insertion for our adductor muscles and also our quadriceps muscles. This is the popliteal surface. As we continue distally, we have our femoral condyles. We have a lateral condyle and a medial condyle, and we can see these from the front as well. Lateral condyle and medial condyle, and you'll see that they have slightly different shapes. And then just like at our elbow joint, we have epicondyles, which are little projections on the medial and lateral side. So this one would be our lateral epicondyle, this little bony point. And then this little prominence over here would be our medial epicondyle. Now there's an additional little bump off of our medial femoral condyle here, right in this region. I'll zoom in a little bit so you can see. Right in this region here. This is where the adductor magnus is going to insert, and we call that the adductor tubercle. Okay, so that's not to be confused with the medial epicondyle, which is here. The adductor tubercle is a little bit more superior. It's a little bit more superior and a little bit more posterior to that. Now on this anterior side, we can also see in between the two condyles, so we have our intercondylar groove, and this becomes the patellar surface, where the patella will actually come and meet with the femur. And speaking of the patella, we might as well go over a couple of the landmarks on the patella as well. Here we have the patella. So I'm orienting you to the superior aspect and the inferior aspect here. You can see it's almost diamond shaped. Now the pointy part that is pointing actually inferior is called the apex. Okay, and then we have the most superior aspect, which is called the base. So that seems a little bit backwards, but remember, the wider aspect is going to be called the base. The pointier aspect would be called the apex. We have an anterior surface here, and then we have a posterior surface, and we have some articular facets. So this would be an articular facet for the medial condyle. It's a little bit smaller, and then this larger surface area for the lateral condyle.